The best part of my working day really has to be just working with such a great MDT and kind of other professionals around. This makes the job easier, makes the job more fun, and yeah, it's definitely something that I love doing.
I really enjoy sort of the interaction between team members and members of staff and the patients. So just the whole dynamic, it's a very supportive environment. So in terms of encouraging patients, in terms of encouraging each other, it's just really supportive.
As a paramedic in primary care, I absolutely love the autonomy that I have in my role. I've got the ability to lead the patient journey from assessment to diagnosis to referrals. But also actually as a manager and as an advanced clinician, I'm able to help guide services and transform them to help the practices and the patients that I work for.
The best part of my working day is the fact that it's really varied. So sometimes you're out going to GP clinics and running a clinic of back-to-back patients. Sometimes you're out doing education, so you're actually teaching a whole class of people using food models and training them how to manage their diabetes.
Probably the best part of the day for me is definitely the MDT working. So I work a lot on the intensive care unit and the general ward. So it's the getting together kind of as a team. So that may well be a meeting to discuss a patient or working together with that patient, with the physios, the occupational therapists, the dietitians, and coming up with kind of a collaborative plan for those patients. So it's definitely the MDT working side.
When I'm in anaesthetics, the patients that come in are at their most vulnerable moments, and it's really important to gain their trust in that very short space of time. And they all come with a varied emotions. Some are angry, some are in pain, some are sad, afraid, and it's trying to reassure them that you're there for them and you're not going to leave their side. And I always say to them, when you see me next, you'll be in recovery and you will be smiling. So after the case, I always try and make an effort to go and see them in recovery, and true enough, they're usually sat in their beds, they're always smiling. That's a very humbling experience to know that I've been able to do that for my patients.
The classes that we run here are now back doing face-to-face, so it's lovely seeing the patients interact with each other, giving each other kind of advice and kind of motivating each other, and we often swap recipe ideas as well.